when I was a little kid. I had a skateboarding accident, pretty much just falling on my face on the concrete and landing on my front teeth. It broke like the front 3 out or so. So when I learned about the 3-on-6, I thought it would be a good option because I had quite a few teeth that were kind of broken, and came in yesterday, October 13th, and got my finals.
Alright, so we've got Michael here. It's been about 4 years since he got his final bridges put in, and they are still looking beautiful. He still has a full mouth of bone and gum tissues. Looks like he's been doing a pretty good job of taking care of them. He did have a couple of his bridges come loose, so we're tightening those down for him. There we go. This case was prior before the photogrammetry technology came out, before we could start doing everything screw retained with the monolithic zirconia. So big words pretty much saying that with the advent of all the coolest, latest, and greatest technologies, we've been able to make these stronger and sturdier so that we don't have to worry about them coming loose as often or having those type of problems. Getting rid of the cement makes it so the implants can all heal up better. The dental industry has come a long way in the past 10 years since we started doing the 3-on-6s. Getting rid of the cement was a big deal. Moving to monolithic zirconia was a big deal. Getting perfect scans and photogrammetry, everything is just all come together at this time so we can make things seamless. And back in his day when he came in and got this, it was not just like 2 visits where you could come and get a beautiful new smile on your first day and then be zeroing it in. So it's like the process from temps to finals these days is so much nicer and easier. Still, for what he had during that time, that's still so much better than what he could have possibly gotten with the all-on-4s, chopping away his bone and putting in like a fake denture in there. Still able to keep his own natural gum line. Still looking like his own natural gums are doing well. So that is great. Does that still feel lopsided?
Mm-hmm. Only this side is touching.
Okay. So yeah, hopefully anybody watching this realizes that this we don't cement anymore. We do everything is all screw retained. And it's just so much better in all the different ways. All right, so we re-cemented a couple of his final bridges back in there, and now we're just polishing them for him so they're nice and shiny and pretty.
Nice. Yeah, it feels nice because I used to be able to push with my tongue on the back of them, and it would feel like it was like. Mm-hmm. And whenever I would eat, that would happen and like pull down on the front. Yeah. But these feel nice and tight now.
Yeah, they should be solid. You can see he still has really nice pink healthy gums around here, and they're all just right up to his teeth. Look on the bottoms, you can see it's still nice pink healthy gums and bone all up right to his teeth. So that's what our goal is, to try and get the gums and the bone to just maintain. So because this is broken up into 3 segmented bridges, it helps stimulate bone growth up here so that the bone can keep getting stronger and stronger and actually growing bone. And growing bone and gum tissues down here. That's one of the big advantages of the 3-on-6 is breaking it up into bridges, stimulates bone growth, which prevents bone loss and prevents gum loss. So he's 4 years in, we're not seeing any bone loss or gum tissue loss in there.
How long do these typically last, or are they supposed to last forever?
They should last forever, as long as you keep coming in for your cleanings and maintenance and everything and taking good care of them at home. They should last you forever. You're 4 years in, you look like you still have all of your bone and gum tissue. The concern would be like if your bridges were here and now there's a big old gap between your bridges and your gums and your bone, then you say, oh crap, we're losing our bone and our gum tissue, but you still have your bone and your gum tissue. So as long as you can maintain that, then you should be able to keep them forever. So AlgaCal is one of those, it's just a supplement that you can take that helps maintain your bone mass, your bone density.
Is it like a pill, vitamin type pill?
Yeah, it's calcium that comes from algae. And I've just seen with my patients that are taking it, they're a lot less likely to lose their bone. So if you're not taking that, I'd start taking that. So the combination of making sure that you're taking good care of your health and then keeping them really clean. And then if you do start seeing it getting red anywhere, then it's more likely to start losing bone in that area. So let's make sure that you don't allow it to get red.
And just brush and floss.
Brush, floss, and use the water pick. Yep. Do you have a water pick?
I do. I just got a new, slimmer one, so I'll be using it more from you guys today.
Awesome. But yeah, looks like you're doing a pretty good job of keeping them clean. All right.
Well, thank you for your help. Well, this is my truck. I drive over the road for a living. It's actually what brought me here to Utah Smile Clinic. Truck driving's what's allowed me to get my 3-on-6 done, and allowed me to eat a lot better while being on the road and eat more healthy snacks. You know, I just kind of had to eat what I could before, but after getting this done, I've been able to eat a lot more healthy. And this is where I live. Still got the Christmas lights up from Christmas, but haven't put those up yet. Having the 3-on-6 done has been pretty nice for the truck rather than dentures or anything like that, because, you know, trying to glue them and all that, you know, doing it on the truck and extra stuff to keep and have to find a store to go get the glue, and it's just easier having the 3-on-6, and the maintenance is a lot better, and you can get like a water floss or a small water floss. I got one from here from Utah Smile Clinic today, a nice small one, a lot easier for the road. Before, eating nuts was pretty hard and it could be painful with my teeth, but with the 3-on-6, it's just not an issue anymore. I can eat pistachios if I want. Yeah, I would highly recommend the 3-on-6 to anybody who's thinking about trying to get something done, who has really bad teeth, or, you know, wants to stop having teeth pain. It's just a really good option. The technology for it is just getting better every day. A lot more easy for my lifestyle.